A lot of times when patients come back to see us after starting treatment for their sleep apnea, it is life-changing for them because when you're sleep deprived, it affects your mood. A lot of patients have irritability. Their spouse's sleep is interrupted because if the patient is snoring or having these long pauses without breathing, their spouse is having a difficult time sleeping because a lot of times we hear from the spouse that I can't sleep because of the snoring or I can't sleep because I'm having to constantly remind him to breathe. So the patients come back and they say that they are sleeping much better during the night. They have more energy during the day. A lot of times without treatment, if they sit quietly just for a few minutes, they're falling asleep. But with treatment, they say they're able to stay awake during the day. A lot of times they're treated for depression before finding a diagnosis of sleep apnea. So they're no longer on medication for depression because overall well-being, they just feel better. As far as the St. Francis Sleep Center and our patients and why they do so well as far as compliance is because one, we work really close with them. We do follow-up calls to see how they're doing with therapy. We encourage them to call us if they're having any difficulties. The medical supply companies can monitor their use. And if a patient goes a few days without using their machine, because they remotely monitor those things, they call the patient, ask them what problems they're having and how can they help resolve those issues. Our follow-up, we usually have them back in the clinic within 1 month to 6 weeks to see how they're doing with therapy and address any issues they're having. And if they're doing okay at that point, we see them at 3 months, then at a 6-month interval, and then at least once a year. So we follow them closely. The patients, they're told to call us at any time with any problems. If they're started on CPAP and they're having sleep issues, call us and let us know that. If their mask is not fitting well or having air leaks, call us and we get those issues resolved. And a lot of patients that we see also have to show DOT compliance for the Department of Transportation because we see patients that are school bus drivers or they drive 18-wheelers or so when they're diagnosed with sleep apnea, they have to actually come in and show that they're using their machine because it does affect them being able to stay awake on the highways. And so we see those patients as well, and they have to bring a form in from their physician that we fill out to show that they're actually using their machine. And if they are not compliant, they are in jeopardy of losing their license. One other service, in addition to treating patients with narcolepsy, we have a lot of patients, especially the younger patients that come in, and a lot of times people misunderstand them to think that they're just being lazy and they don't have any drive to do anything. And so because these patients have a difficult time staying awake during the day, that's often a misconception. So once we identify that they have narcolepsy and we treat these patients, you give them a quality of life where they're able to go to school and stay awake and function and able to go on jobs and have relationships. Because a lot of times we have patients report that their girlfriend or boyfriend broke up with them because they just feel like they're not interested in doing anything, that they just want to sleep all the time. So it's very rewarding to be able to give them that quality of life. The faith-based approach at St. Francis means a lot to me. I actually drive an hour and 15 minutes to work here at St. Francis. I've actually worked at several different other hospitals that's not their philosophy, and you certainly can tell the difference. Here at St. Francis, you really don't feel like you're being micromanaged, that you're given the freedom to deliver care to your patients in a caring and compassionate manner, that it's not just about the paperwork and those things. It's more about the care of the patient. And so for that reason, I drive here and I enjoy working here, and I encourage others to work here for that reason because it's just a totally different atmosphere.